Yes, so for the next drug we should be looking at, its pharmacology. This is a drug that has two names. Alright. So one of it is known as what? Albuterol. Why you see it mostly in the USA is it's called what? Salbutamol. Alright. So straight up to the pharmacology, get to see the mechanism of action. Just so is a beta 2 adrenergic receptor agonist. Do you understand? So when you say a drug is an agonist, this drug is activating the receptor. This drug is supporting the actions of the receptor. Alright, so it binds to beta 2 receptors on the bronchial smooth muscles. It will now increase what? Cyclic adenosine monophosphate. This will now activate protein kinase A, which will now inhibit myosin phosphorylation. It will reduce intracellular calcium. Alright, so result, it will now cause smooth muscles to relax. So it's basically involved in or applied in disease conditions that your smooth muscles are constricting. Do you know? So to cause relaxation, if it is in the lungs, it will cause bronchodilation, then it will make airflow to be easily in the lungs. So from the mechanism of action, you can get to start knowing applications of the drugs. Of course, it will be important in disease conditions that are making it difficult for you to breathe. So pharmacodynamics, onset of action is within 15 minutes, so it's quick. Duration is about 3 to 6 hours, right, up to 8 hours orally. Half-life is approximately 3 to 6 hours. Selectivity is 20 times more selective for beta 2. You understand? It loves beta 2 receptors more than beta 1. Alright, so for this drug, you see that it's basically used for all those asthma, COPD. So it's usually made in inhalers for asthma patients and chronic obstructive pulmonary disease patients. So pharmacokinetics, absorption is rapid via the lungs and GIT. It will be metabolized into inactive metabolites, which will be excreted. Excretion is primary via the kidneys. So it's used in treating all those lungs issues: asthma, COPD, hyperkalemia, premature labor. Alright, so adverse effects: tremor, tachycardia, palpitations, headache, anxiety. Metabolic effects like hypokalemia, because it's used in treating hyperkalemia, so you can tilt you into the hypo. The respiratory issues, okay, sometimes.